I already uploaded fabrication for some class. Here I will attach with link. If you want to see the full fabrication of that video, please see that video. Now coming to C-Clasp, it mainly engages in the buccocervical undercut. This is the buccocervical undercut. It aids in retention. Other name of C-Clasp is 3/4 clasp. Advantages: it is easy to fabricate. And the disadvantages are it cannot be used in partially erupted teeth. The video for C-Clasp is already uploaded in my video. U-Clasp, it is also known as full clasp or Jackson clasp. It is also engages in buccocervical undercut like C-Clasp. It engages in mesial and distal proximal undercut. Advantages are it is easy to construct and also it has adequate retention. Disadvantages are like C-Clasp, it cannot be used for partially erupted teeth. Adams clasp, it is also called as Liverpool clasp, universal clasp, modified arrowhead clasp. It has 2 arrowhead, 1 bridge and 2 retentive arms which is placed on the palatal surface. The video for Adams clasp is also uploaded. Advantages: it has excellent advantage and also rigid. It is used in primary and permanent dentition, partially or fully erupted tooth. It is small and occupies minimal space. This clasp can be modified. Disadvantages: in some cases soft tissue irritation seen. Adams with a single arrowhead, it is used in partially erupted tooth, usually last molar. Adams with a J-hook, here the J-hook is soldered to the Adams clasp which is used for engagement of elastics. Adams clasp with incorporated helix, it is also used for engaging elastics. Adams clasp with soldered buccal tube, here the buccal tube is soldered with the Adams clasp which permits use of extra oral anchorage using face bow and headgear assembly. Adams clasp with additional arrowhead, here an additional arrowhead is soldered to the Adams clasp and it offers additional retention. Adams clasp with distal extension, it is used for engagement of elastics. Next is Adams clasp or incisor and premolars. It is used in mostly incisor and premolars when additional retention is required. Triangular clasp, this is triangular clasp which is used for additional retention of posterior teeth. Southend clasp, it is well adapted along the cervical margin of both central incisors and it is used when retention required in anterior teeth. Ball end clasp, here the ball is placed on the end of the wire. It is used for additional retention. It is also known as arrowhead clasp. Its drawbacks are it needs special arrowhead forming pliers to form. It occupies large amount of buccal vestibule and also it can injure interdental soft tissues. Clasp is difficult and time consuming. Clozat clasp, it resembles full clasp with additional piece of wire is soldered and it has better retention than full clasp.